Hey there, I'm Dr. Stewart, and I want to talk to you today about medical marijuana in Florida. Now, from a historical perspective, understand that marijuana became legal in Florida in 2014. And over the years, the laws have changed such that the rules around marijuana have relaxed somewhat. Marijuana comes in several different forms. It comes as pills, sprays, oils, tinctures, lotions, patches, edibles. There's even a rectal preparation, but not many people are interested in that one. And there's also smokable and vape forms. Understand that in our practice, we're not offering a smokable form, and it's very uncommon for us to offer a vaping form. The marijuana plant itself has multiple molecules in it. We call those cannabinoids. The two most important and the two most abundant are called CBD and THC, abbreviations you may have heard of before. Those are also the most useful. In Florida, the state distinguishes the two different types of marijuana as low THC and full THC. Low THC has less than 0.8% THC. Full THC is above 0.8%. You need to understand that full THC and high THC aren't the same thing. If you'll stop and think about it, 0.8% is less than 1%. So the full THC category goes from 0.8% or less than 1% all the way upwards of 100%. That's a huge spectrum covering basically everything. So a product can be full THC and not have very much THC in it. Now, the state will require that you complete a consent, and we have the state consent in our office, and we'll help you through that if there are any questions. You also are going to have to fill out an application. The application is available in paper form and an online form. We offer you a paper form as a reference, but we encourage you to do the online form because it's much faster. It's also a few dollars less expensive because on the paper form, you have to get a passport photo, and in the electronic form, the state will just pull your driver's license picture. The process is that we enter you into the registry. The registry is an online database. When we enter you into the registry, you'll receive 2 emails from the state. The first is a username, the second is a password, and you'll need both of those for you to get access to the registry. The reason you're going to want to do that is so that you'll see the order that we put in for you, you'll see how much you have when it expires, you'll be able to see how much is left after you make a purchase from a dispensary. Think of it as sort of like checking your bank account. Now, you need to also understand that because these emails are coming from the state, it is possible that they'll end up in your spam folder, and you'll want to check that periodically just to make sure. Now, you need to understand that after you apply, so it's important that you apply for your marijuana card today, it will take 1 to 4 weeks for your application to be approved. That approval will come to you via email. If you do the application on paper, it will take significantly longer than that. Now, we've had a number of questions from patients over the years about the application process. What if I'm denied? Well, application is a bit of a misnomer. As long as the data that you put on the application matches the data that the state has on file, you're going to be approved. There's no one sitting in Tallahassee determining whether or not you get to be approved. You are simply going to be approved if the data matches. You will eventually get a hard copy license from the state. That will come in the mail. You don't have to wait on that. Your emailed approval is sufficient. Again, remember to check your spam box. The mailed hard copy looks like a driver's license, and you will want to hold on to that. In the short term, printing the email from the state will be sufficient. This card has to be renewed every year. We have some instructions on how to do that, and we'll reprint them for you a year from now when you need it. You need to understand that we will recommend some dispensaries for you. Not all dispensaries have the same goal in mind. Some take a very medical approach, and we like that. Others tend to take more of a recreational view, and those are not our favorite dispensaries. You may use whichever dispensary you choose, but we have found that our patients are oftentimes looking for more of a medical solution than a recreational one, and so they appreciate the recommendations that we make. Ultimately, what will happen is you will go to the dispensary and talk with them. You'll tell them what your problems are, and they'll make a suggestion for you based on the products they have in stock. It's much like shopping for a car or surround sound speakers. If you're not an expert on those matters, you're going to go solicit the advice of the people who work in those places, and they will guide you. There are lots and lots of options. All the dispensaries handle marijuana differently. They process it differently. Some believe in strains, and so they have those funny names that you may have heard of before, like Hindu Kush, and Girl Scout cookies, and 9-pound hammer. But there are also those who create formulations. Both are right. It just depends on which works best for you, and you'll have to spend some time figuring out which one that is. We tend to put your orders in as an oral formulation. There's a couple of big reasons why we do that. The first is that the oral preparations tend to last longer, and most of our patients have chronic problems, so they like to have a long-acting solution. The order also adds a measure of flexibility, because when we put the order in as an oral form, it allows you to purchase pills, sprays, oils, tinctures, and edibles. That's a lot of options for you, and it's fairly limited, for example, if we put in an order for a rectal preparation. There's really only one option there. We are not offering smokable forms at all. I don't believe that smokable marijuana is medical, and implicit in the term medical marijuana is that the product has to be healthy, and there's nothing on this earth that you can smoke that's healthy. In a similar way, we're not a big fan of the vaping. The vaping is a little bit of a cleaner solution, except that it coats your lungs with oil, and we don't think that's a good idea. It's certainly not healthy long term. Moreover, both of these solutions, both of these therapies, last for a short period of time. And again, we want to use something that matches the nature of your pain. Now, we put in an order. You've not heard me use the word prescription, and the reason for that is because marijuana is federally illegal, you can't prescribe it. You can't prescribe anything that's federally illegal. So the vernacular, the industry term, is that you recommend or you order marijuana. And because it's an order or a recommendation, there's a lot of flexibility in how you take it. So we may say, for example, that we will order 10 milligrams 4 times a day of an oral form of full THC cannabis. Well, that's 40 milligrams a day. And if we do that for 70 days, that's 2,800 milligrams. Do you actually need to take 10 milligrams 4 times a day? No. You may find that your schedule only allows 3-time-a-day dosing. You may find that 5 milligrams is all you can handle during the day, but you like 20 milligrams at night. That's still only 30 milligrams in a day, and that's fine. You also, because it's an order, not a prescription, for full THC, I didn't specify which percentage of THC. I didn't specify a breed of sativa or indica marijuana. I didn't specify a strain or a formulation. You have lots of flexibility, and that's where our ongoing visits and your discussion with the staff at the dispensaries will help guide you to the perfect products for you. Now, as you go through this process, you are going to need to make some notes. And when you make the notes, you'll learn which products work well for you under what circumstances. You may find that you have to adjust your dosing depending on whether or not you have a full stomach. That's all very normal. Now, To learn a little bit more about the different THC products, just remember that again, there are the low THC and the full THC. The low THC is really good for arthritis, muscle relaxation, and just generally feeling better without feeling stoned. We like to use that in a pill form because pills are easy. If you drop them, they're easy to pick up, they're easy to swallow, they don't taste bad. This is a nice foundation, and we recommend that you'd use it up to 4 times a day. Breakfast, lunch, dinner, and bedtime when you brush your teeth are nice times to remember it, because at those times you're putting something in your mouth already. The full THC products are used to treat basically everything else: insomnia, pain, neuropathy, nausea, mood. There's all sorts of full THC products, and because these contain more THC, we recommend that you use a liquid form, because we don't know exactly how much THC you can tolerate. And much like metering out a dose of Tylenol for a child, you'll want to be able to try different amounts of product, and you want to have a lot of control over that. For example, say that there's a pill that's 10 milligrams and your perfect dose is 12 milligrams. Well, a 10 milligram doesn't quite get you there, but 2 pills, 20 milligrams, is way too much. So the liquid offers you that flexibility. Now, when you take these, it's going to take a little time for you to figure out the right amounts. So what we recommend is that you try a small amount, usually in the neighborhood of 1/4 to 1/2 syringe initially, and then repeat the dose or slightly increase it 6 to 8 hours later. What we don't want you to do is dose stack. Don't stack doses on top of each other, meaning don't take a dose at, for example, noon. You don't notice much of an effect and you add to it at 1. You don't notice an effect and you add to it at 2. All of a sudden, you're going to have a very strong effect and you're not going to know the proper dose for you. Be a little bit more patient, try a dose, wait for it to fully wear off in 6 to 8 hours, and then step up to a higher dose. We will follow with you every 2 to 3 months. This, we think, is a nice combination of allowing you enough time to try it on your own and play with the different dosing, and also keeping a close enough eye on you that we can be helpful to you. We do recommend that when you start getting product, that you buy small bottles. By buying small bottles, you don't waste your money and you don't waste your allowance on products that aren't helpful. If you are allowed, for example, 1,000 milligrams in a certain time period, and you buy 500 milligrams, a huge bottle of something, and it doesn't work, well, you've really cut into your allowance, spent a lot of money on a product that does you no good. Now, there are some cautions that you need to know about the use of marijuana. You need to remember that it still is federally illegal. Therefore, don't take it across state lines. If you take it to a state where marijuana is medically legal, you could still get arrested because you're not legal in their state. If you take it to a state where it's recreationally legal, you'd be fine. But how are you going to get there? You've either got to drive your car across state lines or you have to get on an airplane, and that's really bad. Never take this to an airport. You need to understand that if you're in your car, you need to have your card, your marijuana card, with you. You need to understand that if you're driving a car, you can get a DUI if you are impaired. Now, our goal for you is to use marijuana and any other medications that we may prescribe you in a safe way so that you can carry on with your normal life's activities, which would include driving. But marijuana, like other substances, can impair you. And if you are driving impaired, you will get a DUI even if you have a marijuana card. You need to understand that federal law is going to be applied in federal buildings. So you want to stay away of courthouses, public schools, the VA, the post office, airports, public transportation. when you have marijuana on you. It may also be a problem to use medical marijuana for certain types of employment. So we do see, for example, nurses who work at large hospitals who get federal money will have a problem with their employees using medical marijuana. The institution will follow federal law because they get federal money. It also is a problem for individuals with a commercial driver's license. You need to be aware of this. We have a number of questions about Second Amendment rights when it comes to marijuana. At this point, there doesn't appear to be any curtailing of Second Amendment rights, with one small exception. When you purchase a gun from a gun dealer, you fill out a background check. That background check will ask, do you use any drugs that are federally illegal, even though your state may have legalized them? If you answer that question truthfully, which is always our recommendation to do so, you will very likely have your application for purchase of that gun denied. Okay? So, you need to do your homework. After you do your application, you've got to call the dispensaries, visit the dispensaries, go to their websites, ask questions, figure out which products you'd like to try and from whom you'd like to buy them. When you get the product, use it, make notes, experiment with it, figure out what works well and under what circumstances. We'll want to discuss that with you. We think marijuana is a great, safe therapy. I have never seen another therapy, particularly a single therapy, do as much for as many conditions at such a low risk as marijuana does. We really think it is the future of medicine and has great potential. We hope that you have great success with marijuana. We're here to answer any questions you may have, and we wish you the best. Thanks for watching.